Hi, Howard Deihl here with the General Agency, and today we will be starting our saving money on health insurance, on group health insurance series. And today we will be starting off with tip number one. So tip number one, if you're offering a PPO, you might want to consider offering an HMO as a low-cost option. The HMOs are pretty affordable, and what I did was I ran a proposal here for one of our customers. They do have 14 employees, and it's with a popular carrier. And I ran some rates so you can see the cost difference between the PPO and the HMO to give you a good idea. So the costs that you're going to see today do include the employer and the employee contribution. So obviously when you see the price tag on there, it does include some of that as payroll. So anyhow, the PPO versus HMO. First, let's go over the plan designs that I ran for this group. Keep in mind they do have 14 employees. The PPO does have a doctor office copay and a drug card on there, which is going to be the same as on the HMO. The out-of-network, the in-network deductible is $3,000. The out-of-network deductible is $6,000. The co-insurance in-network is 70% and 50-50 out-of-network. The maximum out-of-pocket in-network is $8,550, and out-of-network there is no limit, so keep that in mind. There is no stop-loss out-of-network. Remember, when you do go outside the network, you are subject to URC, which stands for Usual, Reasonable, and Customary charges, and I'll touch on that here in just a little bit. But the plan, the sister plan, which is the HMO, the doctor office copay and the drug card are the same as the PPO. The deductible in network is the same as the PPO at $3,000. Same with the co-insurance at 70%, and the maximum out of pocket at $8,550. So the cost difference between the two, the PPO cost is $10,761.85. and the cost of the PPO is the cost of the HMO is $6,903.19. So as you can see, there's a 55% savings between the PPO and the HMO. Now, not too many people offer HMOs anymore, so you'll have to check with your broker to see if they are available. Obviously, you can always call us too, and we can help you with that. Now, the differences between the PPO and the HMOs, there are some advantages and disadvantages. The advantage of the PPO is that you do not need referrals inside the network. So you don't have a primary care doctor that you have to go see first. You can go to any doctor you want to in the network. You can also self-refer to specialists, so no need to call somebody to get that referral. And then obviously the hospital. Now, there are some disadvantages to the PPO, and one of those disadvantages is that if you do go non-network, you are subject to reasonable and customary charges, as I mentioned earlier. Usual, reasonable, and customary means that there's a clause in the insurance contract for doctors that are non-network. The insurance company will only pay going rate for doctors with the training and experience of the person that you saw and in that geographic area. So if your doctor is charging a lot more money than going rate, obviously that difference is not applied to any out-of-pockets. It's just on top of the your out-of-pocket costs. So if you do go non-network, remember on this plan here, you can go non-network. If you do go to the doctor's office non-network, it is deductible first, so that $6,000 deductible is going to apply. Same thing with specialists. If you just go outside the network and go to a specialist, there is coverage, but the deductible is going to apply. Hospitals. If you want to go to a non-network hospital, remember that non-network deductible, it's only going to pay 50% after you've met that deductible, and there is no stop loss on this one. So if that bill is $106,000, you'll end up paying what, $55,000 of it. So be careful if you use a non-network hospital. So it does have those. Now all the items that are in red are things that you need to watch out for on the PPO. Now, we've also run into some situations where people have gone to a in-network facility and they were treated by a non-network physician. And that non-network physician, the payments fell on the non-network side, so they had a $6,000 deductible and only covered it 50%, and reasonable and customary applied, and a whole bunch of other charges. So if you do have a PPO and you're in network, you're going to go for a surgery. You want to make sure that that surgery is well planned, and make sure that all of the people that are going to be providing services to you are in network. Okay, so whichever doctor or surgeon you're talking with, make sure you tell them, hey, if there is a non-network provider on the schedule, reschedule it until everybody is in network. It's a good way to protect yourself from those surprise bills that might pop up on you there. But keep in mind, because there is out-of-network benefits, you could end up with a non-network doctor. Okay. So the HMO works different than the PPO. There is no benefits out of network except for accidents and emergencies, and I'll touch on that in just a moment. The doctor, your doctor, you do have a primary care doctor, which is a gatekeeper, and he needs to make the referrals to any of the specialists that you see. So on the HMO, just remember, if you get sick, anything goes on at all, you do need to call your primary care doctor first. He is your gatekeeper, and they are on call. So always make sure that you call your primary care doctor. The hospitals are in network, pre-authorization is required. Make sure you stay inside the network, always on the HMO. Now, the HMO network is for a geographic area. So for us here in the Dallas-Fort Worth Metroplex, the geographic area will cover 19 counties or something like that. I don't know how many counties, but anyway, quite a few counties. It's just in that geographic area. Now, if you travel outside of that geographic area, you still have coverage. As a matter of fact, you have coverage on the HMO worldwide also. But it only covers for accidents and emergencies when you're outside of the network. So if you get a severe cold and you're non-network, you do need to call your primary care doctor and say, hey, I'm in New York, I've got a bad cold, and this is what's going on, and he will either prescribe you medication or refer you to a doctor that's in the area that you're in. But he will handle that for you. He's the gatekeeper. If you're in Colorado skiing and you break your leg, the ambulance driver is going to take you to the hospital of his choosing, not yours. So, and he doesn't care about your network. He doesn't care about those things. He's going to rush you to the nearest hospital or emergency room, and they're going to provide treatment. Now, that hospital may be non-network, so the insurance companies, what they do is they treat you as if you were in network for the accident or emergency. And then once you're stabilized, they'll move you to a network facility, or a partner facility. That's the way the HMO works. So you do have coverage worldwide on the HMO, but of course you obviously don't have the flexibility of the PPO. So there are advantages and disadvantages to both. It's just a personal preference. So, in conclusion, considering offering an HMO as a low-cost option. If you have the ability to offer a dual option HMO PPO combination, like in this scenario here, the employer is only required to make contributions to the low cost option. So as an employer, you're saving 55% just by offering that low cost option. And then if the employees want to buy up to the PPO, then they could spend the additional money out of their check and buy up to the PPO. So for more money saving tips on this, remember to subscribe to our channel and like this video, and we will be coming out with more videos. The next couple ones we're going to do how much benefits really cost an employer. You don't want to miss that one. And we'll be doing another one on some reference-based pricing with the PPOs when the HMOs are not available, and a number of other cost-saving videos. So stay tuned for those. They'll be short, so hopefully they won't be too confusing. And we hope to see you here next time. Once again, remember to subscribe to our channel and like this video. Thank you.